There's been a concerted effort today by government and by scientific advisors to reassure people about the efficacy of the vaccines being used in the UK. It follows growing concern about the performance of the Oxford-AstraZeneca vaccine, specifically in the context of the South African variant of the virus. Boris Johnson said he was very confident that the current vaccines delivered a high degree of protection against serious illness. And Professor Jonathan Van-Tam, who's England's Deputy Chief Medical Officer, said it was unlikely in his view that the South African variant would become dominant here in the short term. Now, tonight in England, people aged 70 or older who haven't yet been called for their vaccination are being asked to contact the NHS to book an appointment. Our medical editor Fergus Walsh has the latest.
There is huge public enthusiasm for COVID immunisation. Elland Road, home of Leeds United Football Club, is now a mass vaccination hub. Joshua is 25 and has very severe asthma. He's been shielding at home and has only come out to have his jab.
It was like being locked up, in a way. It was like being kept in a cage, and then having this is like getting the key to get out.
Where have you come from today, Margaret?
Margaret's husband has been in intensive care with COVID for nearly a month.
I just wish this had come earlier so my husband could have had it.
Visiting a COVID testing kit supplier in Derby, the Prime Minister said vaccines are the way out of the pandemic for all of us.
We're very confident in all the vaccines that we're using, and I think it's important for people to bear in mind that all of them we think are effective in delivering a high degree of protection against serious illness and death.
That was in response to a small study in South Africa which suggested the Oxford-AstraZeneca vaccine offered only limited protection against mild to moderate infection from the main variant there. 147 cases of the South African variant have been detected in the UK, and people in several areas like Worcester are being tested in a bid to prevent it spreading further.
Do you think it will be possible to keep the South African variant largely suppressed in the UK?
The early modelling data do not suggest a transmissibility advantage for this virus. And because of that, there is no reason to think the South African variant will catch up or overtake our current virus in the next few months.
And that's good news because vaccines are highly effective at protecting against the Kent variant, which is dominant here.
My advice to you is very simple. Do not delay. Have the vaccine that will protect you against the current threat. And don't worry, you can be revaccinated.
Anyone over 70 in England who's not yet had their vaccine is being asked to contact the NHS online or by calling 119, as the UK looks well on track to have given around 15 million people in the highest risk groups their first dose by the middle of February. Fergus Walsh, BBC News.
As we've been reporting, new vaccines are already in development to protect against the new South African variant of coronavirus. The next phase of the pandemic could increasingly become a game of catch-up as more new variants emerge and new vaccines are developed to tackle them. Our science editor David Shukman considers what might lie ahead.
Around the world, there's now a race between the virus and the vaccines, between the threat of new variants and efforts to stay ahead of them. And the outcome matters to us all. While a first wave of countries, including the UK, should see the majority of their populations vaccinated this year, others won't reach that stage till next year, and many will have to wait for the year after or even longer.
This is a global virus, it's a global pandemic. Until we're all protected, then it could be that a variant in another country mutates so that the current vaccines are no longer effective, and that will come back. So even those people who are vaccinated, they are still going to be at risk of these future variants.
The virus is changing all the time, and when it infects human cells, it takes over and gets them to make millions of copies. But they won't all be the same. Each batch may have some random genetic mistakes, mutations that are usually unimportant, but a few might prove dangerous. So the first task is to track these changes, and that's done by studying the genetic code of the virus. Since December 2019, when it was first confirmed in Wuhan, scientists have monitored what's effectively a family tree with hundreds of different branches. Each of these lines represents one of the many different variants that's emerged over the course of the past year. And it's only by doing this genetic research that we can spot the variants that are worrying in the UK, Brazil and South Africa. 500,000 British coronavirus samples have gone through genetic screening so far. These machines are among those that have done most of the analysis. But few countries can work on this almost industrial scale, so there's a lot we don't know about how the virus is changing worldwide.
There are thousands or millions of cases globally. There are undoubtedly other variants of COVID that are spreading quickly, but we're just blind to. And any one of those additional strains around the world could confer an advantage for the virus, allow it to reinfect people even though they've been vaccinated. And that's what we want to protect against.
One answer is to have a global screening operation. In West Africa 5 years ago, mobile labs studied the Ebola virus. Something far larger is needed now. And alongside that, the faster the vaccines can be rolled out and adapted as new variants emerge, the safer we'll all be. David Shukman, BBC News.
Time to look at the latest government figures now then. They show there were 14,104 new infections recorded in the latest 24-hour period. That means an average of 17,740 new cases per day in the past week. Across the UK, 29,326 people are in hospital right now with coronavirus. Another 333 deaths were reported. That's people who died within 28 days of a positive COVID test. On average, in the past week, 891 deaths were announced every day. And the total number of UK deaths is now 112,798. Let me give you the latest on the vaccination programme. 278,988 people had a first dose of one of the 3 approved vaccines in the latest 24-hour period. And that takes the overall number of people who've had their first jab to 12,294,006. With that, let's bring in our medical editor, Fergus Walsh. And I suppose, Fergus, I'd ask you to comment on that remarkable figure of over 12 million.
Yeah, the take-up of the COVID vaccine here is extraordinary, Hugh. 91% of those over 80 have had their first dose. 95% of those aged 75 to 79 have had one. Now, that's way above what was expected. And whenever I talk to people at immunisation centres, there is a genuine sense of optimism and relief that they're getting immunised. The Pfizer and the AstraZeneca vaccines are both highly effective against the dominant Kent variant here. So that's why it's vital people continue to come forward. And we should soon see an impact in terms of reduction in hospital numbers and deaths from the vaccination programme. And the longer term goal is to offer a first dose to all those over 50 and with underlying health conditions, 32 million people by May. Now, there's news tonight of another new variant of concern in Manchester with extra surge testing there, but we're going to have to get used to that. New variants will emerge all the time, but the vaccines can be fairly easily tweaked. And a bit like flu, we may need a booster, perhaps this autumn, maybe later.
Fergus, good to talk to you. Thank you very much. Fergus Walsh there with the latest analysis, our medical editor.